Hi, my name is Tamara, and I'm with Vannon Healthcare Services. This is a continuation of a video series of different tips that we're going to be given to help your practice, whether you've been in practice for many years or you're just starting out. Today's tip is patient eligibility. The eligibility basically starts at the time the appointment is made. When the patient calls in, requests an appointment via the computer, your website. Getting the patient demographics is the biggest key. Getting their name, birth date, address, their insurance information, and then from there, it's up to the staff to start working on the verification. The patient insurance verification process is various steps. First step basically is when the patient schedules the appointment, then we call, or you call, and verify the benefits if anything needs to be authorized. And ultimately, all of that information comes down to your claim submission. If for some reason you don't get the eligibility check and you do a procedure and come to find out afterwards it needed authorization, then unfortunately that claim is going to be denied. Checking the patient eligibility is very important to your practice. This way you can maximize your reimbursement from the insurance companies. You're probably wondering why checking the patient eligibility is so important. One, it's going to improve the speed of the care that the provider is going to be giving the patient. It's also going to reduce claim denials. So if you already received the eligibility and they tell you an authorization is needed, you already have that up front, so you're not going to get the claim denied. And then if for some reason you don't check the eligibility and the claim gets rejected, then it goes back to the patient, which is going to reduce bad debt, collection for the patient, hopefully not, but you never know. And overall, it's just very time consuming. If you can check the eligibility up front, it's going to save the practice a lot of time and money. One tip that I would give to any practice would be to create an eligibility checklist for your front office staff or whoever you have checking the benefits. Basically, you would have the patient's name, date of birth, insurance information. They can write down any copays, any deductibles, any procedures that may or may not be covered, how many visits depending on the specialty. This way, the information that you receive from the insurance company would be very helpful to the provider and staff. Also on the template, you can add a section for pre-authorizations for any testing procedures that the doctor may order. I hope you have found this video helpful. Please subscribe for more. If you are a small or large practice, we can provide you with a free consultation to see if there are any areas that need improvement.